Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. Welcome to the Healers Café. And today I have a really special guest. One that I've gotten to know a little bit more, and that's why I can make that special differentiation. Her name is Amber MacPhail, and she's a 27-year-old New Zealander. I didn't say that properly. New Zealander who's moved to British Columbia, or had anyways, to study to become a naturopathic doctor. And a few things happened. So I think your bio is really such a creation of inspiration, possibilities, and everything that I'm just gonna, first of all, give it to you, welcome you, and maybe expand on that bio a little bit, and or tie it into the journey that you went through.
Yeah, absolutely. Thanks, Manon. Yeah, so I'm Amber. So I moved to Vancouver to study to be a naturopathic doctor. Basically, after my undergrad in New Zealand, I wasn't quite sure what I was meant to do with myself, with my life. I decided to study to be a vet. Didn't work out. Didn't realize quite early on I didn't want to just suppress symptoms in animals. Like that happens, and with humans in the conventional medical system. So I studied biochemistry and genetics for fun. And then afterwards was like, oh, I don't want to work in a lab. What am I meant to do with myself? I got very depressed, was really depressed for about half a year to a year, but I knew deep down that, again, conventional medicines like antidepressants was not actually going to fix anything. So I was very lucky to be put on to a German medical doctor who practices homeopathy in New Zealand by family friends. I went and saw her, and yeah, everything changed. I stepped into a whole new life. It felt like it was amazing. So I took homeopathic remedy treatment from this homeopath, and then I also decided to take a plant medicine journey. I took magic mushrooms, and I was shown what my path forward was. So I actually saw a hand passing medicine to somebody, and I thought, I thought I never wanted to work with humans, or especially children, so closely, and here I am seeing that this is what I'm meant to be doing. So things continued to accelerate after that. I researched online the best medical training I could find in the world, knowing that I didn't just want to suppress symptoms and actually wanted to get to the deeper cause of disease. And then, yeah, I ended up at a naturopathic doctor school in Vancouver, which doesn't exist in New Zealand. They are like primary care providers. And oh man, we learn everything: acupuncture, herbs, homeopathy, chiropractic, counseling, on and on and on. But I was 1 year away from finishing, and I wasn't able to finish because I wouldn't receive the mandated vaccine at the time.
We're calling it a bioweapon because
yeah.
So I'm really careful about words in that way, because
not actually a vaccine, is it? It's not like that. That's not what it's. Yeah. No, it's not. They had to change the definition, right, to make it fit. So when I was in New Zealand studying online for a little bit, waiting to get over there, waiting, wasn't able to travel. And as soon as we heard that some of the Australian airlines were requiring the bioweapon to travel, I thought, nah, screw that. I'm not going then. That's not even an option. So I knew from my gut feeling at the start that would never be part of, the journey. I managed to slip over to Canada without getting it, and then it held me up at the end anyway. And of course, I sunk a lot of money and energy, and I moved across the world for this studying, and unfortunately I couldn't finish. But at the end of the day, it all worked out for the best.
Yeah, I mean, it's a huge commitment, and also financially. I mean, what is it now, like 100K a year?
Oh, yeah, it's a huge amount of money for sure, and it's all for that fancy certificate. That's what it comes down to. Yeah.
Yeah.
Yes.
Yes.
I
You don't get the support when you realize that they're not independent.
Mhm.
That's where it also gets really tricky, right? Like, we're supposed to be learning things that are good for the body, that help, the people heal, that work with the immune system, that don't suppress. And here we are, mandated to do something, and our own governing bodies and schools just enforce it.
Yeah.
I was appalled to find this out. I just could not. I actually had this feeling that, wow, this is our chance to really get out and tell people, take zinc, take, all these natural things, and let's get our systems up to date, be fit, blah blah blah. Instead, slap, 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 and
Yeah.
suppress. And anyway, yes, sorry, it's your story, but it's like I live it through everybody else that has gone through this. Yeah.
It's strange because the things we're taught about, individualized medicine and this and that, and then they were using very unscientific like rat tests for the unvaccinated students, like segregating us from the rest, and it just made no logical sense, and that was a really tough part as well. So yeah, no, it was very disturbing and very confusing and very surprising. And yeah, so it turned out that the medical school I went to was pretty conventional. We learned biomedicine, pathology, physiology, anatomy from quite a conventional point of view, and we used natural products, again, like green allopathy. Natural products can suppress symptoms as well, right? We weren't really stimulating the vital force to overcome disease and imbalance. So I got to learn that outside of Boucher, which was very lucky for me. And yeah, it all worked out. Yeah.
Yeah,
So
so what then, yeah, tell us a little bit more
yeah, totally. I'll keep going. So I mentioned that these kind of like the education there was a little bit conventional, and I went to Canada to get the best medical training I could, and I did end up receiving that, and that wasn't from Boucher. It turns out two big modalities really seemed to push the needle the most, and that was homeopathy and Bowen therapy. So I guess I learned about these modalities through medical school, but not at medical school. So luckily I was redirected into a wonderful classical homeopathy education outside of Boucher, and also with Bowen therapy with you, and that just changed everything. And the best part is neither of them are that invasive or intrusive. And because what I see now is really interesting is people say, I hate to admit it, but Bowen therapy really worked for me, because people seem to want more, and make it painful. And then it will work. The therapy will work if that's the case. And that just isn't how it has to be. There's a lot of unlearning to do, Yeah.
a lot of misconceptions to get over. Yeah.
Absolutely. Yeah. And while I was in Canada, I received some other amazing therapies. One was actually an animal medicine called Combo. It's from a frog, and it helped me kind of cleanse myself of all these like accumulated environmental toxicities from growing up on a conventional dairy farm in New Zealand, heavy metals, emotional suppression, all that kind of stuff. And then I became more and more intuitive, more and more in tune, which I'm actually learning to manage a little bit now, because I kind of am a bit too open and a bit too sensitive to other people's stuff. So that's the next part of this is the current part of my journey that I'm working on. Yeah. So it's been great. Yeah.
So it's not the end when there's something that blocks the way forward. I mean, there might be a big loss financially, but in your case, you're a positive person anyways, despite the depression diagnosis. But you found a way through, just continue the education. And can you explain a little bit that path, because often we think it's supposed to be a certain way, or we go to a certain place to get things. How does it really work, and what's your experience?
Yeah, definitely. And even on the mention of the depression diagnosis, the cool thing about the homeopathy is it cured me. I never have struggled with that again. That's not my story, part of my story anymore. And that is what is possible. That is actually what the kind of healing that we achieve, you know. It's not just like, oh, dampen every feeling and emotions. You don't feel depressed, but you don't feel happy either or excited. It's like, no, this is completely gone. But yes, I guess I was under the misconception that, you know, you need like a certificate, a title. I'm going to be a doctor, then I will be respected, I will be useful, da da da. But when I was waiting to get into my final year, hoping that the mandate would drop, I was tutoring like 8-9 students, a lot of them also unvaccinated. It was really great to help people in that way. So I became really proficient in all those kind of conventional medical sciences and things like that. And I was waiting, and then I was like, wait a second, I can see that I'm going to become a jack of all trades and master of none. Let's actually go deeper into a couple of the really powerful kind of modalities. So I was like, well, once I released the ego of not being a doctor anymore, I was like, right, let's get some good, serious training, some expert training from people who are very specialized in their fields. And I just started kind of putting feelers out. Things came to me, and I just fell into some incredible things. And it just, the path just kind of unfolded as I let go of like expectations, assumptions from other people, for myself. And don't know what else to tell you. It just worked out so beautifully, and things just aligned. And then once I trained with you, I decided like, right, time to go home, time to live rurally again on the land, serve my community. And then since I've been home, all I've heard about is this various little issues, ailments people have. And I'm like, okay, this is all working out as well. And now people are coming, and there's word of mouth, and people just get better. And it can be quite hard for them to come to terms with the fact that they can let go of their issue. Yeah.
Yeah, that actually is one of the hardest things. You know,
Yes.
people say they want to heal, but and I'm not saying they don't. I mean, many really do. But there's also partially we've been programmed with the idea that we can't really heal. So there's the other part of us that's holding on to things, kind of saying, well, I guess that's always going to be a part of me.
Yes,
Right?
totally. And I hear a lot, it's like, oh, so how is your sciatica? They're like, oh, I haven't had it, but I also haven't done this or this, which usually causes it. And I'm like, okay, like not having it is significant as well. You don't have to like make little excuses why it's gone away. So I see that is a funny thing. And there is that unlearning piece to it, right? People don't usually completely heal from things, and in our like kind of modern society. So there's you've got to let go of that attachment to suffering and to being a victim a lot of times as well, which is not easy. Yeah.
So like in your case, I mean, like you said, you let go of the ego attachment to a label, right?
Yeah.
But you actually do have a big part of the education
Yeah.
that was needed. But when you look at just everything you've learned, including the deep dives in homeopathy and Bowen Therapy, what do you think it takes to either to really help people? What is it about? Is it like, obviously the answer is not the degree, clearly, but what does it take, and maybe to help free people a little bit from their preconceptions?
That is a very good big question, Mano. Thank you for asking. Well, I guess because I'm still learning this, I'm still very early in my journey, but I guess I don't like to have an opinion on what is going on for them. I like to let them tell me in lesser words and observations and symptoms and little quirks what is going on for them. And I kind of like to just sit back, because a lot of the kind of counseling and psychology stuff is like, oh, I think this is why this is the case. And I'm like, I'm not really interested in that. I have learned that people have their own individual susceptibilities that make them respond predictably to stresses. and they respond to stresses through symptoms. And if I can sit back and let them tell me these little predictable ways that they respond, then I can easily kind of see the bigger picture, see deeper to the level of the vital force, how they respond. And then I can kind of, how do I say it? And then I can kind of just help them heal themselves. I'm not doing anything. I'm just sitting back and facilitating what that is. And a lot of the difficulty I'm learning is how to sit in others' suffering, because if I were to take that suffering away from them, they're losing out on lessons, on lots of things like that, how to heal themselves. And I've learned that healing is not necessarily smooth and easy.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen Therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
Example is the detox reaction or the healing crisis that happens as well. And I've seen that a few times, which is a very interesting phenomenon. Yeah. So I don't know if that made much sense. I hope so.
Other opinions. I mean, I do think the listening piece is huge, because often that's what starts the trust relationship and the acknowledgement of what's going on, and then the responsibility that actually one can make a difference in one's own life by making certain decisions and choices. So it kind of starts everything. But when you abdicate that responsibility with a typical visit to your medical qualified practitioner who has much less time for you, and that's a systemic problem, it's not necessarily individual, but we're in a system, then the problem is the patient can never really speak. They never feel heard. They get diagnosed, usually one body part or one thing at a time, as if things are not interconnected. And then it's kind of like, well, the only responsibility you have is take this, and take what? Okay, and so what? It's like you miss the ball entirely of what the process is about.
It's so true. And the biggest thing I've been learning recently is putting external things into the body is not often that useful or necessary, especially when detoxification is a big part of the process. It's like, no, don't put more active things in that need to be processed and detoxified. Just kind of get the body, the mind, all of that into a space where they're like, now we're in healing mode. Now we're putting energy into these processes to heal, to detox, to flush whatever it is. And it doesn't have to come from the outside. And humans love to take bad things and put them in, and this helps for this system, this helps for the system. But if we're just coming in and interrupting a pathway or adding in more ingredients for this pathway, you're just going to kind of throw things off, because we're just so unfathomably complex. We can't really come and knife around in there and have much of a good effect. We've kind of got to leave it up to the whole person, the whole system. Yeah.
For sure. So well, we have a bit more time together, but I'd love to hear, because I know you're new in practice, and I know that you've had some great results. So why don't you maybe share, just no names, obviously, for all the same reasons as usual, but what surprised you of possibility in healing? Like, yeah, tell us.
Yeah, I've got a couple of goodies for sure. So one that was really awesome was an older man I treated for the first time. He came and he had a really swollen hand, like super red, puffy, like the whole hand was, and I could not tell him to get antibiotics. I was like, oh, that looks bad. Like I can't say not to do anything conventional in terms of that. And after the first treatment, which didn't even address his hand, by the way, it was just the whole nervous system, the whole body, his hand 100% came right. No redness, no swelling. And I was like, what?
So doing the basic reboot of Bowen.
Basic reboot of Bowen. That's all they did. And it just, and you know, older people as well, they are assumed, oh, you're old, you can't heal as well. Overnight. It was amazing. So that was one.
So but did he, when you said you can't, and you know, what we don't prescribe, we can't unprescribe. That's, you know, a general rule, because we're not the one on top. But had he started, had he taken anything?
Oh, I saw him beforehand and he said, oh, what do you think? Should I go to the doctor? And I said, oh, well, they will prescribe antibiotics. And I can't say don't do that because it looks infected. But he hadn't got there yet. And he didn't have to go in the end. And that was...
Yes, that's the best way.
Yeah, so that's so great. So we first aid and everything, but a more kind of chronic situation, we've got a couple, was a girl, she came to me, I guess she was almost 30, and she had this terrible sciatica, but it wasn't a normal sciatica. It was like numbness, like motor, could not move her foot sometimes. Anyway, I saw her for about like 8 weeks, which is longer than usual that you need to kind of continue with Bowen. And we had huge improvements in the end, never quite fully better, but weirdly enough, her scoliosis completely was corrected by the end of it. And I didn't even realize actually she had scoliosis, which but her physio said, oh my gosh, you've got no curvature to your spine anymore, like in the scoliosis sense. And something so complex as scoliosis just cannot really be fixed with bracing or surgical rods. It's just too complex. The body has to be the one to correct that. And that blew my mind. That was just, I've heard that Bowen can help with scoliosis, but we accidentally fixed it. That was the coolest thing. Yeah.
So accidentally, because she didn't bother telling.
She didn't tell me because her chief concern was so severe. That's all she wanted to focus on. Mm-hmm.
And then in your treatment protocol, anyways, you would just do where the problem is first, right?
Exactly.
It just comes to show how, you know, the body's gonna do what it has to do.
Yeah.
And maybe the acute in that sense was, though it seemed semi-chronic for her, at least reoccurring, but you know, the body's gonna do the holistic thing anyways.
Totally.
Exactly. And that's also why it may have taken 8 treatments.
Yeah, definitely. And because sorry.
That makes total sense. Yeah.
There's often like a lot of deep emotional, traumatic beliefs, things that are like stored. And I saw that come up big time with a woman who was just under 30 and she had terrible sciatica, everything was standing, could barely drive. Standing desk, you know, to counter it. And we were addressing it. I think it was the 3rd session. And during one of the moves that I did with Bowen, a traumatic event from childhood like came up right in front of her face. And she told me she tried to suppress it, but she couldn't. This person's face was in front of her face and she was freaked out. Anyway, she knew where this came from and in childhood. And then afterwards she cried and cried and cried and cried. And after that, no sciatica, completely gone. So that was it can be a little bit difficult, can be a little bit uncomfortable to really honor and experience what is stored for it to then be released. And then the body doesn't have to adapt to that anymore. Yeah.
Yeah, no. But and you know, it really makes the point, you know, that when I made, you know, all the changes in the curriculum for Bowen College, you know, the importance of preparing also the practitioner to be able to like allow for the healing space, to allow for it, to even create it, because healing is so much more profound if you as a practitioner have gone through your own journey,
Yes,
so
it's
yeah,
true.
I'm not surprised you're getting these great results.
Yeah, it's just the coolest thing for sure. And even things from like rashes, like after a treatment, I gave a woman, and then it lifted like a layer of suppression, and her rash flared up really bad right after the treatment on her arms. So then I was like, okay, come here, I'll just do a quick, like I cleared the shoulder, the elbow, and her rash went away like within seconds. And I'm just like, this is too good to be true. This is so crazy. It gets me every time. Yeah. Every time. Yeah. And
How do you see homeopathy? How are you seeing how you're going to work with that? How to integrate that, or
it's a good question. So homeopathy is an absolute art form in itself, and I'm very humbled by it all the time, and I'm treating carefully with it because it also has such a bad rap, and I'm almost a little bit protective of it because it helped me so much in my journey. But I guess I have been using Bowen and homeopathy together if it feels like significant enough. And I'm not quite sure how to explain that. Sometimes I'll say, oh, I know that this is your remedy, but I'm not going to give it to you because I don't think you're necessarily suffering enough in these ways, and Bowen itself can handle the job. But if it is like for example, a client had really terrible sciatica, but also very terrible vertigo. And in that instance, the remedy I found, I gave, and then popped them on the table for Bowen. And then the next day, vertigo gone completely, didn't come back again, but sciatica still working through a few sessions with Bowen. So yeah, I'm learning a lot with these two. I'm playing around, and if there's a big mental health component, like terrible anxiety or whatever as well, often I'll give the remedy too. But yeah, I don't know. I've had advice from you in the past with it. I've had advice from other people. And at the end of the day, if you use both and it's appropriate, you can absolutely change someone's experience completely. And it's just the coolest thing. And it takes months for homeopathy to fully work as well. So I'm also learning less is more. I have to sit back and just wait a lot. So yeah, but Bowen, you can do every week, and it's the coolest thing.
Yeah. Well, I always found it the most beautiful mix, is I was grateful to have Bowen because I could see more people and get results and keep my my belief in myself that I can actually make a difference because people respond to that so quickly. Whereas homeopathy, it's like 17 hours to find a remedy. It's the wrong remedy. It's like it has no impact, and then so it can be very discouraging. And it took me years, maybe 8 to 10 years to really feel like I'm starting to understand homeopathy, and I would say to master it, it might be 15, 20 years, like it's it's a really in-depth but beautiful therapy, and then the dance between the two, it's I like to know what I'm doing and why I'm doing it and what I'm following, so I kind of separate them, but there are times where they make sense together. And, and I think this is all our learning curve, right? There is no absolute way for, it's very individualized, so it'll be interesting to talk in 10 years and find out how you do.
Definitely, because even as you're talking, I realized there are some instances, like with homeopathy, if someone has gone through a big head injury or spine injury, often they can shift into a remedy that is a state because of that. And quite often then either I'll do Bowen for a while, clear up blockages, get muscles and things, fascia working really well, give them the remedy and things just flow so beautifully because you've cleared a lot of stored stuff from the body, and then you've pushed the vital force to fully overcome, the issues. So that seems to be like a really awesome way of using it. And yeah, and one client, she's very sensitive. I found her remedy, but then in my learning, I repeated it too many times and she had like a worsening. I gave her Bowen, cleared up all this suppressed stored stuff. Then when the time was right, gave her the remedy again, and she said overnight she felt like she became the person she always wanted to be. It was not this sense of doom anymore. She just felt completely amazing. So the way that they interact with each other there's so much to learn. It's just the coolest thing. It's so exciting. Yeah.
Bowen can help detox and clear things, and
oh yeah,
it's great.
Oh, can it ever? It can definitely detox and clear things. I've seen that like crazy. Yeah, it's the coolest.
Well, our time is up. So any last statement you want to make of either encouragement to people who need help or to people wanting to learn? All of that's possible.
Yeah, I guess one of the biggest, coolest things I've found through this therapies that I've been learning is that people are meant to feel everything. I know it sucks to suffer and to feel pain and to feel this and that, but at the end of the day, that's what we're meant to do as humans. We're meant to experience things fully so that we do not store it in our physiology for it to then fester and brew and come out worse later on. And it's hard because modern Western society doesn't like to feel difficult things, and we've just got to normalize it. It's how it's got to be. Yeah.
All right. Well, I'm going to leave it with those words, and thanks so much for your time.
Thank you. This was lovely.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.